Hello, my name is Dr. Steve Wisnieski. I'm a physical medicine and rehabilitation physician at the Mayo Clinic in Rochester, Minnesota. I'm privileged to be joined by Dr. Paul Lento, who is an associate professor of physical medicine and rehabilitation at Temple University. And we are currently at the American Academy of Physical Medicine and Rehabilitation annual meeting in Orlando, Florida. Paul and I are both actively engaged in doing a lot of musculoskeletal ultrasound in our practice. Paul, ultrasound's been a really hot topic for the last number of years. How are you currently utilizing musculoskeletal ultrasound in your practice?
Basically, I use it as an extension of the history and physical examination. So a couple of ways I think patients appreciate that. One is after talking with them, trying to figure out what their problem is, and then doing a good examination. If I think that musculoskeletal ultrasound can be utilized, we'll use that as an extension of that and try to take a look at the problem with the use of the ultrasound. Oftentimes that can hone in on where the problem might be.
How do you think it's improved patient care? What things are you able to do now that you think is helping your overall patient care?
Well, I think in many ways there's a couple of things. I think one is from a point of care standpoint, you can do an ultrasound right in the office. I think most Americans are familiar with MRI more so than ultrasound, but nowadays you can do an ultrasound right in the office. I think it's an extension almost like a stethoscope for a cardiologist or for a family practice doctor in internal medicine. I can pull out the ultrasound and place that on a muscle or a tendon to see if there's a soft tissue injury and give the patient, as well as the referring physician, a better understanding of what might be going on. And I think that's helpful in not only diagnosing but also instituting care and also planning further treatment, whether that's through therapy, medications, or even an injection.
Yeah, I'd agree. The ability to use ultrasound right when you're seeing the patient at the time that you're seeing the patient, I think is a real advantage. And you can give patient feedback and make a more firm diagnosis quicker, certainly with the use of ultrasound. It's a very quick and easy modality to use in a busy clinic day. So how did you learn musculoskeletal ultrasound and kind of can you go us through the steps of how you picked up ultrasound and how you continue to learn further musculoskeletal ultrasound to improve your skills?
Well, I think in the United States it's pretty new, and my exposure to it really happened back in 2002 at the Salt Lake Winter Olympics, and I was very fortunate to be asked to work there. And when I was there, I was impressed that most of the American athletes that came in from the U.S. team asked for an MRI or an X-ray, yet when the European athletes would come in, frequently they asked for a musculoskeletal ultrasound. And it just struck me very oddly that you have these very well-trained athletes who are very in tune with their bodies really didn't want an MRI, they wanted a musculoskeletal ultrasound. And from that point on, I caught wind of also some European physicians, family practice doctors actually, who used it in their office. And to me, that sounded like a pretty interesting idea. Traveled over to Europe and saw how it was utilized and all the research that was being done, and then came back to the United States and started reading and working along with some physicians at the Mayo Clinic and started instituting a lot of the original type of work that we've now started to do on it.
So Dr. Lento actually was the initial course director for our Introduction to Musculoskeletal Ultrasound course that the Academy of Physical Medicine and Rehabilitation has on at least an annual basis now, and he did that for a number of years, so really was one of the pioneers as far as education. Ultrasound in our academy now has really exploded. This year alone we had 5 multiple-day ultrasound injection courses that the Academy puts on, so he's really been at the forefront of physician education. For physicians that are out there in practice that are interested in getting ultrasound into their practice and really expanding those skills, how would you recommend one go about doing that?
Well, I think it's one of those imaging modalities. People often look at us as physiatrists or other primary care doctors, rheumatologists, orthopedic surgeons, that we're not radiologists. And I think the good thing about how we utilize ultrasound is that we use it in addition to our history and physical examination. So how do you get trained in it? I would suggest, obviously, attending some courses, reading books, and much like anything, whether it's physical examination maneuvers or reading x-rays, is just repetition and practice. And I have to say that a lot of the physicians at the Mayo Clinic are some of the leading teachers and researchers in the area, so as many times as I can, whenever there's a course around that time and Mayo's involved, I'm right there with it.
So what do you think the future of ultrasound holds? It's a relatively new modality for us as PM&R physicians as far as diagnostic ultrasound or using it to guide injections. Where do you think the research should go? What do you think the future brings for the use of ultrasound?
Well, I mean, it's really in its infancy at this point. I think from many ways. One is from a diagnostic standpoint. I think they're now using ultrasound to maybe diagnose a lot of neuromuscular disorders earlier. There's some European literature looking at that. from Duchenne's muscular dystrophy anywhere to neurogenic disorders such as ALS. So that's one method. That's in, say, neuromuscular disorders. I think in the musculoskeletal realm, we're starting to see things with ultrasound as the technology is improving. Certainly the diagnoses that we're seeing and the tissue resolution that we're seeing with ultrasound is just opening so many doors in terms of pathology. And then not only that, but then from an interventional standpoint, we're really being precise with placing medications, biologics, and all the research that's coming out along with those. I mean, the field is wide open at this point.
Yeah, I can certainly comment on that as well. I started ultrasound about 6 years ago, and certainly the ability to visualize structures now in those 6 short years has just advanced leaps and bounds from when I first started. The detail that you can see things now with the regular ultrasound machines is just incredible. Well, Paul, thanks a lot for your time. I appreciate you talking ultrasound with me.
It's my pleasure. A lot of fun.